Hello everyone. Today we'll discuss new evidence from the New England Journal of Medicine and the ASCO Post about low-dose aspirin in localized colorectal cancer with PI3K pathway alterations. As primary care providers, you are often the first point of contact for cancer survivors, so understanding this data is important for long-term follow-up and counseling. Aspirin has long been recognized for reducing the risk of colorectal adenomas and colorectal cancer in high-risk populations. Observational studies suggested that patients with tumors harboring PI3K-Ca mutations might also benefit from aspirin after diagnosis, with improved disease-free survival. But until now, we didn't have randomized trial data to support this. The ALASCCA trial was a Scandinavian study conducted in Sweden, Norway, Denmark, and Finland. It was double-blind, randomized, and placebo-controlled. Enrolled patients had stage 1-3 rectal cancer or stage 2-3 colon cancer with somatic alterations in PI3K pathway genes, PIK3CA, PIK3R1, or PTEN. Patients were randomized to receive aspirin 160 mg daily or placebo for 3 years. The primary endpoint was recurrence among patients with PIK3CA hotspot mutations. In patients with PIK3CA hotspot mutations, the 3-year recurrence rate was 7.7% with aspirin versus 14.1% with placebo, HR 0.49. For other PI3K alterations, recurrence was also reduced, 7.7% versus 16.8%, HR 0.42. Disease-free survival was numerically better in both groups, especially Group B, HR 0.51, statistically significant. Non-severe adverse events occurred in 43.4% of aspirin patients versus 35.4% with placebo. Severe adverse events occurred in 16.8% versus 11.6%, respectively. The most common were gastrointestinal disorders, 6.5% versus 3.9%, and cardiovascular disorders, 5.8% versus 4.2%. Genomic testing matters. About 37% of colorectal cancers in the trial had PI3K pathway alterations. Potential benefit: aspirin cut recurrence risk by roughly half in this subgroup. Not universal. This benefit is tied to molecular alterations, not all colorectal cancer survivors. Safety is critical. Adverse events, especially GI and cardiovascular, were more frequent with aspirin. Primary care role: be aware of genomic testing results in your patients. If they have PI3K pathway alterations, coordinate with oncology to discuss whether aspirin might be considered, always weighing risks and benefits. In summary, this landmark trial highlights how precision medicine can extend even to familiar drugs like aspirin. For patients with PI3K-altered colorectal cancer, low-dose aspirin may reduce recurrence risk, but safety must remain front and center in discussions. Thank you for watching. Stay tuned for more updates that connect cutting-edge oncology research to everyday primary care.